the pain in the back, but here when you are here in this course, in the neurology course, so do everything, okay, for every patient. So this is what I mean also about the cranial nerve. So you ask if the patient smells everything, if it's normal, if he doesn't notice any kind of smell olfactory change. Yeah, so for the first one. For the second one, you ask if he sees the same as before, if there any lowering of visual acuity, and you ask if the patient, okay, so how many fingers do I show, what's that, do you see that clearly, do you see my face clearly? If you have double vision, in which direction, yes, and then you show, for example, your hammer and ask, do you see it, like one, or is it double? If it is double, is it, in vertical direction? Is it in horizontal direction? If it is, sometimes it's in unequal, so you check for the double vision. And when you go for the checking of the eye movements, so the third, the fourth, and the sixth, so you make this horizontal, and always ask the patient not to move his head, yes, and to keep the head straight, yes, and only the movement of the eyes, yes, so we have the cornea coming to the corner of the palpebral, yes, in this direction, up, down, and then in oblique, yes, like this, yeah, and like this, and down. Try to do it rather slowly, okay, and explain to the patient what you are checking, and not make it too quick to follow it for that. Then, when you are checking the movement of the eyes, you also look for nystagmus. Yes, the direction of nystagmus is into the fast phase, yes, correction phase, yes, so if the patient is looking on the right side, and we will have nystagmus when looking into the right side, but the with face is into the left, so we have the left-sided nystagmus. Yes, when you write it, put it down in the case. So we look for the nystagmus, and we check for the component of nystagmus. And to enhance nystagmus, if you are not sure if it is so, you ask the patient to move the head, for example, like into the maximum position, and then check it again, so to look if it's vascular, yes, if you have it vestibular. If you have it vestibular, so you will have one-sided nystagmus, like with a high amplitude and with a rotational component. When you have it for the cerebellar, for example, dysfunction, it's small nystagmus. The amplitude is small, it's rather like both sides, it's equal into the both sides, and it doesn't depend on the movement of the head or on the position of the patient. So we check for the eye movements and for the nystagmus, and then accommodation, yes, and convergation. You ask patient to follow the hammer, and you also look for the strabismus. Yes, if it is not divergating, then the patient is having convergence, and also you check for the reaction of the pupil to accommodation and convergation. Yes, when it's converging, it should be getting smaller. Yes, that's it. When we go for the reaction to the light, always ask the patient not to look into the light, to look somewhere from here, somewhere away, not to get it, and so it's the direct reaction to the light, yes, we have it, and then the indirect, you also see the reaction of the other eye reacting to the light. If you, okay, that's not for the movie, if you don't have the other eye also reacting to the light coming in one eye, yes, so the reaction to the light. If you have pupil, that size of the pupils, it's not equal, but the reaction to the light, it's okay, then it's usually normal. It's just an isochoria that might be congenital and nothing to do with that. If you have white pupil not reacting to the light, then it's a signal to look for some serious disorder. Sometimes it might be, for example, okay, like in the sinus cavernosus affection or to look for the aneurysm of the arteries. So if it's not reacting to the light, then it's a signal that it is pathological. And if you have no reaction to light but reaction to accommodation, yes, then you look for other diseases causing this divergence of the symptoms. Yes. So accommodation, conjugation, reaction to the light, visual field testing. So you ask the patient to look into your eyes. You do it like this and ask if he sees my fingers moving. Yes, on the both sides. Yes, so we do it with one. Which one I'm moving? Yes, and now, and now. Okay, so it's okay with that. Yes, and for this visual field testing. Yes, you can do it also with the colors. Usually we don't do it with the colors on the bedside testing. Okay, so the fifth one, we do it like this, like that, and in here for all the three branches. Yes, and you ask if it feels touching or it feels pain. And if you have the brush, you can make it with sensation with the brush. If you don't have it, make it with the needle, checking both sides. And if you have it, the difference of feeling on the very middle line, be cautious. No, it's because if it is really organic, it should be a little bit aside, like 1 centimeter, 2 centimeters from the middle line, because in here the fibers, they are crossing. So if you have it directly in the middle of the line, it might be functional. So you have to check it for several times and to see if it's not changing. So you evaluate the sensation. On the face, you ask if the patient feels any kind of pain, any kind of tingling, if there is hyperesthesia, if there is any kind of hypoesthesia in the face, and then go checking for the masticatory function. Ask the patient to clench the teeth, and you check if there is no atrophies. If the strength is okay, you ask the patient to try to open the mouth, okay, with this. So you check the fifth one, and the seventh one, you look at the symmetry of the face, at the symmetry of the wrinkles in the forehead, at the symmetry of the nasolabial wrinkle here, at the symmetry of the mouth corners, and you ask the patient to raise the eyebrows, yes, to throw, okay, it's okay, to throw like you are angry, yes, try to close the eyes really firmly, to make like you have soap in the eyes, so try to make it really, and you try to open, yes, and you shouldn't open it very like with light washing like this. Then you ask the patient to smell. You look if the nostrils, they are moving all together. Yes, you have got to ask to blow the, yes, it's okay with both sides, and then to smile to see if it's raising, okay. The forearm, sometimes it's the Botox, you don't have the wrinkles, but it's normal, I guess. And sometimes we do have it in the emergency rooms with the facial asymmetry, and it's really funny, so you have to ask for that sometimes if you don't have growing of the forearm. Okay, so that's the facial one. Then you go for the vulvar part, yes. So ask the patient to open the mouth to say ah loudly, really loudly. I mean like short and loud ah, to see if the throat if the palatus is moving symmetrically. And for the gag reflex, use the wooden. If you don't have, use the spoon of the patient. It's on the bedside. Should we do that? Okay, so that's you see if it is present, if it is elevated, if brisk one, or is it absent. And you ask the patient to pull out the tongue, and you ask the patient to move the tongue into the both directions, and then you examine the tongue when it's laying in the mouth. Just ask the patient to open the mouth and look at the tongue, not putting it out, to see for the fasciculations. And for the atrophies, if you are suspecting this motor neuron disease, so you look for the fasciculations. It's different from, sometimes you have this restless tongue, but it's not like that. If you have a patient with this, it's rather demonstrative. It's like movement, like small waves in the tongue, the fasciculation, so it's really visible. So for this one, and for the head turning, you ask the patient to move the head to one direction, and you ask him to resist your hand to the other one, and then to shrug of the shoulders, yes, that's it, and you will look at the back to see the scapula. That's it for the vestibular function, but the the cranial nerves, when we examine that, we also examine this vestibular function. So we ask the patient to stand in this rhomboid position, to put the feet together, to spread the arms, and not to close the eyes first. When you ask to close the eyes, if it's okay, and if you want to make it, more complicated, you ask the patient to put the feet like this into one line and to stand like this, and if it's okay, so that means the vestibular function is more or less okay. So I guess that's the examination, and now I will go and check if we have the lady in her bed, if she's not for some kind of a...
Thank you.